Hi and welcome. Today we are going to talk about the power of nitric oxide, specifically 6 evidence-based techniques that you can use in clinical practice. Hi, my name is Dr. Ariane Missimer. I am a functional medicine practitioner, a doctor of physical therapy, registered dietitian, mindfulness instructor, and I am the owner of the Movement Paradigm Integrative Health Center. So nitric oxide is one of our most crucial molecules for bodily functions and overall health. One of the things that is known for the most is vasodilation. So of course, this can affect so many different aspects of our health, from erectile dysfunction to cardiovascular health to even how we're able to get our blood and nutrients to our cells. When looking a little bit more in depth about the specific benefits, one of the things is blood pressure regulation. So a lot of the research that's been done with nitric oxide has been done in hypertensive patients. We also want to think about its ability to reduce platelet aggregation. Essentially, it is increasing cerebral blood flow. So this is really important as we're thinking about more blood flow and how we're actually getting our nutrients to our brain. Vascular function. So again, as I mentioned, this can be associated with erectile dysfunction. So in order to have an erection, as well as even for female sexual health, it is very important to have optimal vasodilation. In addition to that, it is going to reduce oxygen costs during exercise, so it can have an impact on performance. It can affect the mobilization of circulating angiogenic cells, therefore affecting bone marrow. It can affect mitochondrial function. And of course, as it relates to physical exercise, it can increase, as I already mentioned, the performance overall, but also reducing oxygen during exercise and enhancing muscle contractility. So now let's get into the different nitric oxide pathways. So there's 3 primary pathways, and then there's one alternative pathway. So the first pathway is called the NOS pathway. So this is nitric oxide synthase pathway. It's the most well-researched pathway, and it is something that we lose the ability to make nitric oxide via this pathway as we age. The second pathway is the enterosalivary, which is nitrate to nitric oxide pathway, which happens via the posterior tongue with our anaerobic bacteria. And then there's the nitrite to nitric oxide pathway, which happens via dietary intake when we have nitrates that are present in the blood that can be converted to nitric oxide during hypoxic conditions. So this is something we won't go in depth today, but we will talk about the other 2 pathways. And then the last pathway, which is the alternative pathway for nitric oxide, which happens via the parasinuses. So let's start with the NOS pathway, which involves the enzymatic production of nitric oxide from the amino acid L-arginine. So essentially, we're going to start with the NOS enzymes that are present in various cells throughout the body, and that's going to catalyze the production of nitric oxide. So there's 3 different isoforms. There's an endothelial, which is eNOS, neuronal, which is nNOS, and inducible, which is iNOS. The NOS enzymes use L-arginine, oxygen, and NADPH as substrates to produce the nitric oxide. There's different cofactors involved in the process, and once activated, the NOS enzymes are going to convert L-arginine into L-citrulline, with the byproduct being nitric oxide. So then the produced nitric oxide is going to quickly diffuse from the endothelial cells into the smooth muscle cells in blood vessels. And through this, we're going to have signal transduction resulting in an increased in cyclic guanosine monophosphate, which is cGMP. Then this creates the vasodilation effect. So this is going to lead to a series of reactions that causes the smooth muscle to relax, which is what is known as vasodilation, improving blood flow and decreasing blood pressure. So how do we get L-arginine? So this is really important because L-arginine is an amino acid that the body uses in the biosynthesis of proteins. So there's several ways to obtain it. First is endogenous synthesis of L-arginine. So the human body naturally produces L-arginine through the urea cycle. However, the amount synthesized may not always meet the physiological demands, so especially during periods of growth or recovery or illness. And so this is where dietary sources are going to be really important, and they can be consumed through the diet. So high protein foods are excellent sources of this, thinking of your red meat, your poultry, your fish, your dairy products, even some of your plant sources like nuts, seeds, soy products, legumes can also be sources. And it's also known as a conditionally essential amino acid because while it's generally considered a non-essential amino acid because it can be synthesized in the body, it sometimes can be considered conditionally essential because in certain instances like illness or injury, the body's requirement of L-arginine may exceed the ability to produce it, which therefore makes dietary intake very important. So now let's talk about the enterosalivary pathway, which is nitrate to nitrite to nitric oxide pathway. So when we ingest nitrates from our diet through things like celery, beets, or arugula, we are going to, of course, have saliva production. So with the saliva production, it's going to concentrate nitrates about tenfold from plasma, and it's the first step of nitric oxide production. Ultimately, you're going to have nitrates that are in the saliva that are reduced to nitrites by commensal bacteria in the mouth. So this is going to be our anaerobic bacteria that is on the posterior aspect of the tongue. Then it is going to move down to the stomach, and in the acidic environment of the adult stomach, which is a pH of about 1 to 3, the nitrates from the saliva are further reduced to nitric oxide. Ultimately, when we move into the small intestine, we're going to have absorption into the bloodstream, and these nitrites are then absorbed into the bloodstream via the digestive system. We then are going to have blood tissue utilization, so the nitrates in the bloodstream are further reduced to nitric oxide, especially under hypoxic conditions, which occur when tissues, of course, are having lower oxygen levels. And then there is a kidney reabsorption. So the nitrates and nitrates are reabsorbed in the kidneys, completing the enterosalivary circulation of nitrates, and then that contributes to maintaining nitric oxide in the body. So now